Okay, here we go. All right, guys, this is Dr. Wellwood at the Regenerative Medicine Institute. We've got a patient here who's, you can see he's got prior lower back surgery. So she still has chronic pain in her lower back since she was like 15 years old. So we did a neural prolotherapy on her last week, right?
Mm-hmm.
And she said that she has had some relief on the hip areas there. But today, oh, and the scar tissue. Is that what you said too, Pam?
The scar tissue.
And the scar tissue. So today we're going to do a little bit of the scar tissue, but then we're also going to get this area in here. She says she's having some pain where her hardware is. So, because you have hardware in here, correct?
No.
Oh, okay, so we had a laminectomy instead of, okay. So we have a laminectomy done. So there's no hardware, but more than likely there's scar tissue under there. So I've already prepped my injection tray. That's what we're going to be doing. We're doing prolozone today. So the prolozone is going to be a little bit of a local anesthetic with some B-complex and buffered D5W, so it's going to help with some nerve pain that she's always having. And then we have 20 micrograms per milliliter of ozone that's already prepped for us as well. So we're basically going to find out where she's having pain at. So we're going to mark her where her hip bones actually start. So if you guys have any questions, you can type them down and I'll answer them later, but obviously I'm not going to have the ability to actually answer you. So basically just marking sacrum right here. So here is her one hip joint, the iliac crest, and here's the other one. If you put your fingers like this and go right down here, then that right there where she's tender at is the interspace for L4, L5. And then we're going to go down here. There's S1 right there. So very gently pushing down here just to make sure that she doesn't have any increase in pain there.
L405 is where I had surgery twice.
See, there you go. L405 is where the patient said she had surgery twice. So we're going to be marking these areas over here. So we're going to take one finger breath over here. This is L5, so we're going to go right a little bit lower so we can hit lamina, a little bit of transverse process. Right through here, these are going to be our entry points. So, and then we're going to possibly do a little bit of sacral scar tissue today as well, depending on how it goes. So that's the markings that I'm going to be using today. Most often, we mark it with an eyeliner. Eyeliner doesn't tend to come off when we're prepping it. This is a Sharpie. We're going to use a little chlorhexidine and alcohol solution today, which is going to be mixed. So into there, that's going to kill any little buggies. Now, most times patients will feel pressure more than anything. The techniques that we use, if you don't like needles, well, needles never feel good anyway. But they don't typically cause a lot of pain, which is the benefit of this type of prolo. The prolo that we're doing again is prolozone. So that's basically using ozone gas in addition to the prolo substance. Now, this is the same type of technique that I use to teach other doctors and providers with across the country. Now, so we're using a padding technique. Of course, hold on, Pam. If you do that, you can always get a really good response from them. Make sure they're awake. Right?
Mm-hmm.
She's being nice to me today. But you want to make sure that you saturate the area. Good. So we're going to start off with the actual vertebrae themselves.
What are you doing?
Huh?
What are you doing?
We're going to do the injection now. Take a breath. Good. There you go. Nice and easy. Beautiful. You're doing good.
Oh my gosh.
A little bit of pressure. There.
Is there a needle in my back?
Yeah. You're doing good. Good. I'm going to switch it off. Is there a trusty hemostat? I'm going to put a little bit of ozone.
Okay.
Take a breath. And pressure. Try not to move your back. There we go. Good. So I put 5 cc's of ozone in there. Now we're going to do the other side. Doing okay so far?
Mm-hmm.
Okay.
Oh.
There we go. Right down on there. You're doing good. There we go. I'm going to do a little bit more ozone over here. Now the idea between the ozone injection is ozone is an anti-inflammatory. It's a pain reliever, and it directly infuses the local tissue with oxygen, which is oftentimes why we continue to have pain in the area even after surgical procedures are done. So we're going to do 2 more paraspinals.
Oh.
There we go.
Ooh.
Right down on there. You're doing great.
You're lucky I can't see nothing.
Good. Wonderful. We're going to do 5 cc's of ozone.
I'm sweating. Ooh.
There you go.
Oh my gosh.
Pressure.
Oh.
Good.
Doctor.
You're doing wonderful. You want me to stop?
I don't know.
So we're going to slow it down just a
Okay.
teeny bit for her.
Just do that.
So we're just going to rub that in there. That'll kind of help it distribute a little bit. Oftentimes people with chronic back pain, they have a more of a pressure than actual pain in the area. Since we're going right through the muscle tissue there itself, anytime you expand it, it causes a little bit of discomfort also. Okay. You doing good?
Yeah, but right there, so I don't feel good.
Right here?
Mhm.
Right where I want to put the next injection? The patient says, right here where I want to put the next needle at is where it doesn't feel good. Well, when you're ready, just let me know.
Oh.
Go? Okay, here we go. So there we go. She's got a lot of scar tissue right there. And I can tell she's got a lot of scar tissue because it's kind of gritty in there. So when you actually do the injection itself, the needle feels gritty when it goes through. So this is the last paraspinal that we're doing. There we go. Lots of pressure. Beautiful. You're doing great. Good. Now we're going to go ahead and do a little bit of scar tissue here.
Do you have a needle hanging out of my back?
No. We're out of there now. So we're going to actually start threading the needle itself through the scar. Scar is keloid, and keloid basically means it opens up and it becomes more bulbous. And oftentimes when that occurs, then you get a lot of pain that wraps around there because the nerves want to sense it. So we're going to do this very quickly because the patient's actually not feeling very comfortable. So I'm going to, there we go, and thread it around, give it a little bit of English. There we go. Good, and you can see me going all the way up there.
Am I moving?
You're doing great.
I'm trying to see.
You're doing wonderful. Good. There. Good job. So we're basically mechanically dissecting this scar right here. The end result is that the pain will go down significantly. There we go. Beautiful. Good. So now we're going to do a little bit of neural prolotherapy. We're going to see if she has any pain anywhere else. Any pain over here?
Oh no, I'm not concentrating on that.
How about here? Anything over here? Over here? Anything in here?
Yeah.
How about anything over here? How about anything right here? Or right here? Okay, so she really just had pain right through here. Is that about right?
Yeah, right there.
Right there?
Right there.
Okay.
Ow!
There we go.
God, you didn't tell me you were going to do that.
She's actually doing pretty good for somebody who really does not like needles. Good. So you can see
I'm
the...
doing good because I trust you.
Yeah, you're doing wonderful. Okay, any pain anywhere else? Anything over here? Here?
Right there.
Right there?
Didn't you just do that?
No,
Ow!
we did.
Son of a... sorry.
There we go. All right. So, obviously painful area. The patient did not like getting that injection. So that was a live prolozone injection with neuroprolotherapy of the right SI joint.